All right, quick testing. If you hear me, please type yes into the chat room so our tech will know when to begin, when we can begin. One more time. Okay, testing. 1, 2, 3. We're good. Good morning, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Oops. Okay, for over 2 decades, eLotus has been your trusted source for TCM continuing education for acupuncturists. We offer the largest selection of online CEU courses with over 3,000 CE hours. If you are a new eLotus member, you can sign up for an eLotus account to receive a free 1 CEU course as a welcome gift. And this offer is valid for new accounts only. Have you visited eLotus lately? If so, you may have noticed that we offer a lot of free TCM resources, which are packed with valuable information that you can use in your practice. If you're a big fan of learning new acupuncture points that you can implement in your practice, we create a new free traditional acupuncture points guide. It's still in progress right now, but we will keep adding new pictures in the future. You can check it out for point name, indication, and location. Some points that you may have forgotten since school. This weekend we will be hosting 2 live CE webinars with Jimmy Yen. And if you are a Gold Pass member, this is included with your Gold Pass. Plus, for today's attendees, we do have a special surprise for you, so be sure to stay until the end of the webinar to see what it is. Before we get started, here's a quick introduction of Jimmy Yen. Jimmy is a seasoned acupuncturist and herbalist with over 10 years of experience. He started his private practice, Achieve Integrative Health, in 2007 and built it into one of the largest acupuncture clinics in the Austin metro area. His clinic is focused on quick, effective, and long-lasting results. And today you're going to hear some clinical prompts from him. So let's go ahead and welcome Jimmy Yen. Jimmy, if you're able to do a quick testing on your end and share your screen also.
Yeah, testing. Can you hear me?
I need to stop share.
Stop share? What?
Oh, me.
Oh, okay.
Okay, your turn.
All right, let me share. Where did it go? Here we go. All right, can you see it?
Yeah.
So that should be okay. All right, so you can hear me good. I don't need to speak any louder. Nope. Yep. Okay, awesome. So let's go ahead and, okay, thanks, Luis. All right, let's go ahead and get started. Oh, Donna, do I just start or?
Yes, you can go ahead and start.
Okay, perfect. Let me navigate through this. So these are some unprecedented times. And so things, we need to do things very different because if we continue to do the same thing, then we're going to get the same results. Let me lower this so I can see the chat. All right, this is the first slide. So I'm going to do a little intro about myself and how I present how I share my information. My purpose and goal of doing these webinars is to, number one, help you as an acupuncturist succeed. Back when I first started, I didn't really have that much help. If I had that help to really excel my skills, my communication, my confidence, I would be a lot more successful than I am right now. So hopefully I can pass on some of that knowledge and success to you. And that's the purpose. And I want you to succeed. My goal is not to give you more information. My goal is to help you succeed. And so in order to do that, we need to better learn how to communicate with our patients. Oh, it shouldn't be just about neuropathy. This part is wrong. It's about neurological conditions. So my goal is to help you communicate better with your patients about neurological conditions. and to produce results. More importantly, produce results with neurological disorders tomorrow, not 1 year from now, not 10 years from now, but how can you produce results like after this weekend, after you learn what I do for acupuncture, herbs, and other modalities, you should be able to start producing results, Monday for your patients. I know a lot of presenters say that, but my systems, as you will see, are super simple and anybody can implement them, right? So that's my goal. And last is to be able to help thousands of people, thousands of ACUs, get 70 to 80% improvement, instead of just helping one person get 100% improvement. So I'm focused on more quantity of the number of people we can help. It may not be 100%, but if we can help 1 million people, attain 70 to 80% results versus just one person getting 100% improvement, there's a huge difference. And my goal is to help you do the first, help a shit ton of people at 70 to 80% results instead of just one person. Okay. And if you have any questions, you can always ask. I will check the chat randomly and not randomly, but frequently, so that I want to answer all of your questions. So one of the things that you may be asking is, for those of y'all who don't know who I am, I apologize, that's my responsibility. Why should you listen to me? So I am the go-to acupuncturist in Austin, Texas for Austin's top neurologist. All the top neurologists refer patients to me. My clinic is also, prior to pre-COVID, my clinic was a rotation clinic for physicians and physician assistants to come learn about acupuncture. And I was trained by some of the top neurologists in the US. And this picture is of Dr. David Kornblath of Johns Hopkins University, which is the second rated hospital for neurology. So I was very fortunate to be trained by him. Also, I'm a member of the Medical Advisory Committee for the Neuropathy Alliance of Texas. That is a nonprofit organization that is a support group for neuropathy. And they have a medical advisory committee, and I am the only acupuncturist on that committee, along with 4 other top neurologists in Austin, Texas. And I was very fortunate and humbled for them to ask me to be on their board. Okay, I've written a couple of books. This is one, Achieve a Life Free of Neuropathy. Actually, to tell you the secret, I didn't write all of this. Actually, 90% of it was written by a ghostwriter. I only wrote 10% of it. This one, Achieve a Life of Wellness, this is my newest book. This one I did write 100%. So it took me a long time. It took me a year. Okay, my sharing style. So for those of you who are here to see, okay, is it worth coming to the weekend webinar? I'm going to tell you the truth. So one thing that I hold, it was one of my values, is being 100% transparent. And so my sharing style is, you're either going to love the way I share or you're going to hate the way I share it. And the biggest complaints that I would say in my past webinars that I've done for eLotus is, number one, my information, or not my techniques, my strategies are too simple. People complain, ACUs complain about, oh, it's so simple, it's too elementary. The way I share it, it's too simple. There's not enough, technical terms, Western medicine terms, is not complex enough. And so they think that whatever I do is too simple, and they don't implement it. Exactly, Luis. Simplicity is actually more difficult than complex. And so that's the first thing that I do that most people do not like. The second thing that most people do not like is I answer questions. I answer everybody's questions. And the reason why I do that is because when I am personally on a webinar and I have questions, I don't want to wait till the end of the webinar to get my questions answered. Personally, I hate that as a listener. And so I don't want to provide that experience for you. So the way I provide experience is I will answer your questions as they come. Okay. And I will make sure I answer everybody's questions. So those are a couple things that people hate the most. All right. Another thing about my sharing style is I'm not going to teach you everything you need to know about neurological disorders. And that may sound counterintuitive, like you're here to learn about it. I'm not going to teach you everything to learn about it. Instead, what I'm going to do is I'm going to share with you how I get phenomenal results now, not 10 years later, or not 10 certification courses later. I'm not going to tell you, hey, you need to take my certification courses for the next 10 years before you can get the same results as I have, that I'm currently getting in my clinic, okay? Like I said earlier on, if you implement the simple systems, the treatment systems that I'm going to share this weekend, you will be able to produce results coming Monday. You do not have to take 10 certification courses or wait 10 years to do that. Okay, so that's the difference between my sharing style. This is not going to be theoretical. It's not going to be like, oh, all this science data and so forth. No, this is all based on results that I get today for the past 13 years and even today in my clinic. Okay, so if you do have any questions, feel free to ask at any time. So what I will be sharing is my secret system of treatments that can be used to treat any neurological disorders with great results, okay? So my question to you, and hopefully y'all can type in some answers, what would you rather learn? Would you rather learn a separate system for every disorder? And let me give you an example. Let's say you want to treat Bell's palsy. Do you want to have to learn a separate system for Bell's palsy, and then a separate system for trigeminal neuralgia, a separate system for essential tremors, a separate system for migraine headaches? Do you want, how many disorders, how many neurological disorders are there, right? Do you want to have to learn a million, basically, systems to treat a disorder, right? Exactly, Vicky. Yeah. Or would you rather learn just one system, one treatment system that can be applied to any disorder, not just neurological disorders, okay? Any disorder. So exactly, like Lisa's, yes, one system, right? So do you want me to feed you fish, or do you want me to teach you how to fish? We tell our patients this all the time, right? It's like, oh, our goal is to teach you how to fish and not feed you, because if I feed you a fish, you'll only eat one day. If I teach you how to fish, you'll be able to provide for yourself and your family for the rest of your life, right? Are you a good cook? No, I'm not necessarily a good cook. I haven't cooked in a while. So what I'm going to teach you is what I do. I've created one system that can be applied to every single disorder. And this weekend, we're going to talk about neurological disorders, but I use that same system to apply to every disorder that I treat in my clinic, right? So for example, my specialty is in neurology, but I will use that same system to treat fertility patients, okay? And another example is, I haven't had a lot of experience treating multiple sclerosis, but I will share, this is going to be a bonus training on Sunday, the last training that I'm going to do. I use my neuropathy system, or my treatment system, and I applied it to a multiple sclerosis MS patient, and we got phenomenal results. And I'll show you some of the results that we got in this weekend. Okay, so I think everybody's consistent. Let's see, orthopedic pain right away. Everybody wants to learn one system. Well, that's what you're going to get. Okay, so the benefits and advantages of my systems: you're not going to have to memorize a million points. There's no specific acupuncture points for a specific disorder. Not in my system. You're not going to have to memorize a million herbs, because all herbs work. All herbs, all formulas work. It's if you get the right diagnosis. That's the key. If you get the right diagnosis, every single acupuncture point works. Every single herb and formula works, right? So like I said, one system. You can use one system to treat all the disorders and get phenomenal results. And the customization, so some people may say, oh, but everybody's different, right? So how can you use the same points for every single patient, right? And it's like, yes. So you want to get into it? I understand you. But if you don't change your mindset, then you're going to hate my system. You're going to probably end up logging off of this webinar. So I'm trying to hopefully switch your mindset to understand what's important. What's important is not the points. The number one question I get asked is, what points do I use? And I'm telling you, it is not the points. It's the diagnosis. It's the system of how to do things. Okay. So Also, the benefits, the last one is become a results-based neurology expert within a year, not 10 years. Okay. Okay, great. So this is the outline of what we're going to do. So day one, neurology, the skill set needed to, I'm going to go over the skill set needed to specialize in TCM neurology. So one thing that has helped me gain my success over the years, and not just in business, but also in treating neurological problems, is I do things the opposite. So my webinar this weekend, and just like I'm doing right now, it's going to be completely the opposite. What you think that you need to be successful treating neurological disorders, I'm going to do the exact opposite. So remember, some people are going to hate it, some people are going to love it, right? And so the first thing on day one, on Saturday, that first morning, I'm going to go over the number one skill set you need to specialize in TCM neurology, but also get great results. And again, it has nothing to do with points. It has nothing to do with herbs. But I'm going to go over that first thing that I'm going to go over. And many of y'all are going to think, oh, let's get on with the points. Let's get on with blah, 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 right? And so then you're going to miss out on the most important thing. So the most important thing is the first thing I'm going to share. So neurological disorders, disorders that TCM can produce phenomenal results. That's day one. And I'm going to go over, actually, the order, I apologize. This slide is a little, needs to be updated. We're going to go over migraine headaches and neuromuscular disorders. So neuromuscular, so there's different subspecialties of neurology, right? Neuromuscular is one of them. So neuromuscular, the main one that I'm going to present is on neuropathy. And then we're going to go over migraine headaches on day one. And then day two, we're going to go over sleep disorders, okay? Insomnia, restless legs syndrome, okay? And movement disorders. I've already been getting emails about how to treat movement disorders. And so movement disorders like tremors, essential tremors, dystonia, those are the ones that I've had success with. I have not treated enough of ALS. I've only treated a couple of patients, probably less than 5 patients of ALS. And the one patient that I did have, and I'll share some of this too. I was able to slow it down until COVID hit. Once COVID hit and he stopped coming, then his health just started deteriorating like crazy. Let's see, movement disorders on day 2, and then like I said, the multiple sclerosis discovery. So I haven't had great success with multiple sclerosis just because I haven't treated hundreds and hundreds of patients. But this one that I'm going to present, he's actually an anesthesiologist. So it was very interesting because he came here instead of doing the traditional Western medicine treatments. And just to give you a little carrot, basically he went from not being able to walk, having a difficult time walking, and not even running, to now he's running 4 miles 3 times a day. 3 times a week. So we've had really great success with that. No psycho-emotional, not neurological, not in the neurological disorders. Okay, so the subspecialties that we're going to go over, and there are tons of subspecialties, right? I'm only going to go over the ones that I've had great success with. I'm not going to give you information that I haven't had great success with. So neuromuscular disorders, headaches, sleep, movement disorders, multiple sclerosis. That's the last one. So these are the ones, the top 4 are the ones I'm going to spend most of my time with, okay? So let's move on. Okay, neuromuscular disorders. So the ones that I'm going to spend most time on, success, is, I'll answer your questions in a bit. Peripheral neuropathy. How many of y'all have watched the peripheral neuropathy webinar that I did for eLotus? How many of y'all have watched that already? If you can type it into the chat. So I'm going to go over a little of it. And I'm going to go over trigeminal neuralgia, Bell's palsy, Oh, so y'all haven't watched it. Okay. So I won't be able to go over the whole complete training of the peripheral neuropathy, but neuropathy is the number one, I would say, no, I wouldn't say number one. It's what we're known for. It's what we're known for in our clinic. And so I'll share with you all the acupuncture, herbs, and also the other modalities that we use to get phenomenal results to reverse neuropathy, because you can reverse nerve damage, okay? Not all of it, but you can reverse some of it. All right, let me answer some questions. Are we going over this today or on the weekend? We are going on the weekend, in detail on the weekend. Today is just a preview of letting everybody know what we're going to go over, and see if you're interested. And again, if you like my sharing style, if you don't, then you probably won't attend. But if you do, you will. Could it be used with success of lateral? Possible, David, possible. Like I said, I only have one system, one treatment system, and I apply it to all neurological disorders, okay? So let's look at the peripheral neuropathy. Peripheral neuropathy is, when they starting having damage. So this is where you want to take some notes, okay? You're starting to have some damage with your nerves. The progression of peripheral neuropathy is, number one, you start having some type of pain. It may be some type of sharp, burning pain. That's usually the step one of nerve damage. The second thing, this is what the patients will feel. The second step or second phase of nerve damage is you'll start getting into the tingling, the pins and needles, the ants crawling, okay? And then the third one, then they start experiencing the numbness. Numbness is the worst. The numbness, when it's numb, their nerves are dead, right? Can they be reversed? Yes, it can. It depends on if it's small fiber or large fiber. And so that is a progression of what the patients feel. Now, there's different types of nerves that can be damaged, right? There's large fiber nerves and there's small fiber nerves. You're probably, I don't know if any of y'all who have treated neuropathy, a lot of neurologists these days are doing biopsies of the nerves to detect small fiber nerve neuropathy, right? Still, there's nothing that Western medicine can do. The number one medication that Western medicine provides is gabapentin, aka Neurontin. All that only works if they have pain, if they have nerve pain, burning, maybe tingling, but it does nothing for numbness. Once a patient reaches numbness, there is nothing medically, Western medically, that can be done. And that's where we excel, because in Chinese medicine, we can actually restore nerve function, right? Now, the two types of nerve, if it's small fiber nerve versus large fiber nerves. If large fiber nerves are damaged, then the chance is virtually 0% of restoring the nerve function. Large fiber nerves, you get the sense, it helps them sense balance, okay, sense the equilibrium. And you'll start noticing these people, they're walking in canes, they're walking on, the little walkers, right? And so those are the ones that most likely we won't be able to reverse. But if it's small fiber nerves are where? They're mostly in your hands and your feet, right? So those you can actually restore depending on how long they've had the neuropathy, which means depending on how long their nerves have been damaged, okay? So the longer they've been damaged, then obviously the least we can restore. But acupuncture is phenomenal for it, and we'll go into details of that, okay? Let me see. Let me answer some questions. Even peripheral neuropathy from chemo radiation. Cynthia, yes. To answer your question, acupuncture can restore the nerve function. That's the number one neuropathy that we treat in our clinic is chemotherapy-induced neuropathy. Okay, so the common questions that people ask, patients ask, is when they have chemotherapy, when is the best time for them to start acupuncture? So the best time to start acupuncture, if you know your patient's going through chemo and radiation, is at the time that they're getting it. That's the best time. So if I can get a patient who's going through chemotherapy and radiation, and I can get them to start the acupuncture at the same time, Basically, I would say that there's a over 90% chance I can restore close to 99% of the nerve function. Okay. Now, there are exceptions. There are some patients who get massive amounts of chemo within a short amount of time. Those situations, it's a little tougher. But in general, I can confidently say, if you can get them to start the day of, even before, before the chemotherapy, just get them prepared for it. But if they can start the day of the chemotherapy and radiation, then you have a higher chance of restoring, close to 90% of their nerve function after they stop the chemotherapy. Okay. Now, if they wait, then of course, the chances decrease. I've had a patient, they stopped the chemotherapy, got all the neuropathy, came in for the clinic, and we restored 99% of it. I even had one patient who was 80 years old. He had chemotherapy, radiation, and his was a weird neuropathy. It's a rare neuropathy. He had nerve damage all over. I would say not nerve damage, but he had neuralgia. The onset of damage all over his face, his whole body, which is rare. Neuropathy usually just occurs in the hands and feet. He got it all over his body and his face. And we were able to eliminate all of it all over his whole body and eliminate about 50% of it in his hands and feet. But here's the thing. Here's the reason why I couldn't reverse more. He had the chemotherapy, I believe, 2 years ago. So it was a long time. Okay, let's move on, because this is not just about neuropathy. So trigeminal neuralgia, right? Trigeminal neuralgia. There are some medical treatments for trigeminal neuralgia, or TN, as it is known. And they do the medications, they do the anti-seizure medications. Some of it helps, but none of it fixes the problem. And so trigeminal neuralgia they call it, what do they call it? It's like a suicide. It will cause you to, commit suicide, because that's how painful it is, right? I think they call it the suicide. How effective and fast is your treatment on trigeminal neuralgia? Great question, Anne. The pain relief is instant. So by the time, I count to 10, they're TN pain. Okay, so trigeminal neuralgia is the inflammation of the trigeminal nerve, which is the 3-branch nerve right here, right? When I put the needles in, typically after 10 seconds, the pain starts to reduce. And then I do a little more. I usually do about 30, 40 needles. Most of the time, the pain is gone by the time I'm done needling the patient, okay? But it's the same system that I'm going to be teaching you how to treat trigeminal neuralgia with Bell's palsy, with peripheral neuropathy. It's the same system, okay? How many needles? 30, 40 needles. I use about 30 to 40 needles on a patient, okay? Let me go up and just answer some questions. Does peripheral neuropathy tend to start in particular parts of the body? Yes, it starts in the hands and feet. Peripheral nerves, small nerves, okay? That's usually where it starts. All right, Bell's palsy and trigeminal neuralgia are very similar, okay? Bell's palsy is just paralysis, right? But it affects the trigeminal nerve, right? So one, trigeminal neuralgia gives you pain. Bell's palsy you have the drooping, you have a loss in function, right? And so they are very, very similar, very similar. The treatment is exactly the same, for trigeminal neuralgia and Bell's palsy. Nancy, is your method similar to Tan's balance method? Yes. My method is a version of Richard Tan's balance method. That's the only thing I use. Okay. I was very fortunate to be mentored by Richard Tan. So for those of y'all who missed out, he was a great presenter. He was a great practitioner, and he was just great all around. I mean, he really wanted to spread the information about Chinese medicine and acupuncture to the whole world. And I was very fortunate that he was willing to share. Not many acupuncturists are willing to share their secrets. So I was very fortunate to study with Richard Tan. Okay, I'm gonna move on. There are questions we can't see. Is this from another platform, or are the questions not visible to everyone? It's just me. Can y'all not see this slide? Can y'all not see my slides? He's referring to the chat. Oh, my bad. Okay. If I don't answer your question, just type it again, okay? Because the chat is going, like warp speed. Okay, so headaches. Everybody treats headaches in their clinic, right? Everybody treats the headaches. So what am I going to talk about? I'm going to talk about migraine headaches, right? I'm going to talk about the chronic daily headaches. There's different causes of migraine headaches. The number one cause of migraine headaches, who knows what's the number one cause of migraine headaches? The problem is not in your head. The problem is somewhere else. The number one source of migraine headaches, who knows? Who knows this? Number one cause of migraine headaches. All of them are causes, but there's a number one cause of migraine headaches. I'm not seeing it, so I'm just going to tell y'all. Oh, someone said it. C. Sarton, your neck. The number one cause of any headache, number one cause, I'm not saying it's the only cause, I'm saying it's the number one cause, is cervicogenic, which means problems in the neck. So if you can direct your treatments towards fixing the neck by decreasing inflammation in the neck, you will solve majority of your migraine headache patients. It's that simple, okay? Yes, there's other problems, there's other causes. So should we all get neck massages? Yes, we should all get neck massages. Yes, if you just focus your acupuncture treatments on the neck, if you don't like it, regardless of what's the cause, stress, hormonal, medication, like number 3 is medication overuse headache. Regardless of any of those, if you just focus on the neck, you will get great results. You'll get relief, at least 50%, guaranteed. Okay. So these are the things that I will be going over, that I get great results. Again, the focus is on increasing the blood circulation to the neck to decrease the inflammation, right? Herbs is a complete different. Okay, this is just acupuncture. If you focus acupuncture on the neck, you'll get great results of any type of headache. Okay, but herbs, you do need to have a diagnosis. You do need to know. I mean, you could use herbs to decrease inflammation off the neck, and that will still help. But there are other causes, and like one of the ones that I'll share a case study is the hormonal. So I treated this, just hormonal migraines. She only gets a migraine on the cycle day 1 and cycle day 2. The rest of the 26 days, she has no migraines at all. So she only gets it on cycle day 1 and cycle day 2. And so for that patient, I only use Chinese herbs, nothing else. And that's another benefit. This is how I do things in my clinic. So I have a biochemistry background. Before I went to Chinese medicine, I graduated from University of Texas at Austin with a bachelor's in biochemistry. So I used to be a biochemist. So I like to do things step by step. And so part of my treatment systems is doing things step by step. When a new patient comes into my office, I do not instantly just start doing acupuncture, manual therapy, herbs, nutrition, diet. I don't do that. I don't throw the kitchen sink, at the patient. I do one thing at a time. So I know exactly cause and effect. And that's how I can tell you exactly what works, because I'll add herbs. I'll do acupuncture first, and then I'll add herbs, and then I'll add manual therapy, and then I'll add dietary. I won't do them all at the same time. I do them one by one and observe the effect. Then I know exactly if something helped the patient, I know exactly how to help. I know exactly what did it, and I can duplicate it. If something gave a side effect on the flip side, right? So on the flip side, if something, if you threw the kitchen sink at them and something happened, they got an adverse reaction, what caused the adverse reaction? It could be any of those, modalities that you used, right? And so the key in my treatment systems is knowing exactly what does what. So for this migraine, hormonal migraine, all I did with her was herbs, Chinese herbs. In my clinic, I prescribe 1 week of herbs at a time. I do granule herbs, evergreen herbs, okay? And so I prescribe herbs 1 week at a time, and then I feel their pulse. So two of my mentors, one was Richard Tan for acupuncture, and for pulse diagnosis, my mentor is Jimmy Chang. So if you haven't studied with Jimmy Chang, then definitely, you want to, study it, because eLotus has tons of Jimmy Chang's webinars. So I prescribe herbs solely based off the pulse. I do not prescribe herbs based off of symptoms. It doesn't really matter what the patient says. It's just like, Jimmy Chang always jokes around, and I thought he was joking around. He says he just tells his patients to be quiet and not to talk, and because he doesn't listen to their symptoms. All he does is feel their pulse and prescribe the herbs. And I thought he was joking when I was watching his webinar until I interned at his clinic. And when I interned at his clinic, he actually does that. And the patient starts talking, and then he'll tell them, okay, stop talking, okay? And so I don't tell my patients to stop talking, but I don't prescribe herbs based on what they're telling me. I prescribe herbs based on what I feel in the pulse. So going back to this patient, I prescribe 1 week of herbs for 4 weeks straight, okay, and based on the pulse. And as we adjusted the pulse, the next cycle, she only had one migraine the day after. And then the following cycle, her migraines were gone, right? And then, so that's using just Chinese herbs. So you can eliminate headaches, migraines with just herbs. And I've also done on the flip side, I've only done acupuncture and eliminated it, the migraines, okay? So I will share, what I do for both. And I have had patients where they do both. Okay, so sleep. So neurology, sleep. So people, sleep is not just insomnia, okay? I mean, number 2 is insomnia, but it's not just insomnia. So teeth grinding is a sleep disorder, right? They call it bruxism. I didn't know that until I was doing this slide, okay? I just know, the grinding teeth, right? And so the third one is restless leg syndrome, right? These are the 3 main ones, 3 sleep disorders that I've had great success with. The sleep apnea, it depends, because sleep apnea, I'm not going to share about sleep apnea on the weekends, but I'll just share a little bit about my experience. Number 1, I haven't treated a lot of patients with sleep apnea. That's why I'm not going to share about it. Number 2, if they have a structural problem in the palate, really they need that physical device to lift their palate. Otherwise, that's what's shutting their throat, closing their airway. In those situations, I have not seen that acupuncture or Chinese medicine help. What I've seen where Chinese medicine helps with sleep apnea is actually when it's a allergy problem or a sinus problem, respiratory problem. So when you fix the allergy and the respiratory problem, then the sleep apnea actually improves. But also another thing that I found with sleep apnea is that if they get on a CPAP, they're pretty much screwed, right? I mean, being on a CPAP, they'll sleep probably really good for the first couple of years, maybe. But after that, it just goes downhill. And their body becomes so dependent upon that CPAP that, it just messes up their whole system. And they're pretty much going to be tired. I mean, you can improve their quality of life a little, but the CPAP really damages the body, okay? All right. Let me see if I have any questions. Isn't there migraines by neck constriction of blood flow, but also from excess blood flow? Yes, that is very true. Okay, no other questions. Let me move on. Movement disorders. Okay, so movement disorders, the 2 main ones that I've had great success with are essential tremors and dystonia. Okay, so essential tremors are the opposite of Parkinson's. Parkinson's is when you have the tremors and you're at rest, right? I mean, there's also the gait, the shuffle, right? I have not treated enough Parkinson's disorders to say, hey, I'm really good at treating it. So I can't give you too much feedback on that, but I'm damn good on treating essential tremors. Now, the essential tremors, I cannot eliminate it 100%. The essential tremors, what I focus on, and this is what I classify as success. So what I classify as success has nothing to do with me. It has everything to do with the patient. So the patient, during their initial exam, what I ask them is what they would define as success. What would they like to achieve with acupuncture, with their essential tremors? And so essential tremors are tremors when they actually start like writing, right? When they start doing things, activity, motion, the number one thing that patients with essential tremors, I call this their life effect, okay? Life effect basically means what is their essential tremors affecting in their life? So the number one life effect for people who have essential tremors is the ability to, the ability to eat, go out and eat. Okay, so the ability to go out to eat is their number one life effect, which means that's the number one thing they want to be able to do. Why? Because someone with essential tremor, imagine this is a fork or a spoon. When they have essential tremors, they're going like this. They're tossing food left and right. They're trying to go to their mouth, but it doesn't end up in their mouth, right? And they're tremoring the whole time, right? And so that's when they use. So essential tremors are with use. Parkinson's is usually at rest, okay? But then again, remember the first thing I said at the beginning of this webinar. It doesn't matter if it's Parkinson's or essential tremors, the treatment is exactly the same. And in fact, I'm gonna share a case. I've got some video footage because I record my patients, right, to see their tremors. I had a patient who was diagnosed with essential tremors, and recently she just got diagnosed with Parkinson's, right? So my point is the Western medicine diagnosis does not mean anything. It doesn't matter. It does not matter because it does not change what I do. It does not change how I get great results, okay? It helps physicians so that they can give them, physicians like to label their patients so that they know what, they know what medication to give them, okay? But for us, it has nothing to do. It does not change, what I do. And so, so essential tremors. So this patient who has essential tremors and now is recently diagnosed with Parkinson's, right? So I've been treating her since October of last year. So we've actually reversed some of the essential tremors, and her Parkinson's has been non-progressing. So how many months is that? It's 8 months. So 8 months, she has not been progressing. She had Parkinson's way before. She just wasn't diagnosed. So again, the Western medicine diagnosis doesn't really matter, right? And so basically what she can do now, she can eat, okay? I would say probably 80% of the time she's not flicking food. And more importantly, she likes to sew and knit. So she can actually use a thread. Any of y'all knitters or sewers to thread a needle? So this is a person with essential tremor. She can thread a needle, okay? And that's what I tell her to do every single day, right? Okay, someone told me there's a Q&A box. Oh, I see it now. Farr's disease. I have never treated Farr's disease. I have no idea what that is. So sorry. Can you restore nerve function, tingling tremors due to metal toxicity? Yes, you can, Kelly. You can restore any nerve as long as you remove the source. You remove the heavy metal toxicity. So yes, you can. Lisa, does your method help Parkinson's? Yes, I just told you. I can't say that I haven't treated hundreds and hundreds of Parkinson's, so I only have a few cases, right? Probably less than 10 cases. But using my recent treatment systems, it is helping this Parkinson's patient. Will you discuss facial tics? Not much, Kelly. I would say, I would say no in general. More, not necessarily facial tics, but like dystonia. So dystonia is similar, so the dystonia that I've treated, these are involuntary, like, people will go like this, right? So it's kind of a tic. So cervical dystonia, which is what I just, showcased, right? And that's the number one dystonia that I've treated. I've also treated vocal dystonia. I won't be able to show this one without the patient's consent, but we record her. So I basically record her before the treatments of her reading a book. And then we've done, she's also been with me, I think, about 8 months. And her voice is 50% better, right? So the essential tremors, I have not been able to eliminate 100%, but to help them regain their function, that I've definitely done. The dystonia, cervical dystonia, I've reversed it close to 100%. I wouldn't say 100%, but it's very, very close. The vocal dystonia, I have not, just 50%. Okay. Did you mention numb skin from surgical incision years later? Okay. Dahlia, I'm not sure what you're referring to. Can I use herbs for an 89-year-old, very inshu with internal wind, 89-year-old with essential tremors? Yes, you can. I use herbs with everybody, if I need to. So, but I will say with essential tremors, I have done both. So remember, I do things step by step, right? So I've treated essential tremors strictly just with acupuncture. Actually, the case study that I'll be sharing with y'all, I did straight acupuncture, no herbs, only acupuncture. I did some dietary modifications, but not much, not like a full blown. But what I did was acupuncture and a little e-stem, but majority of it was just straight acupuncture. So you can reverse essential tremors. And she's the one that has Parkinson's also. So I just did acupuncture. And then I have another essential tremor where I combine herbs. She was the one with the vocal dystonia. So I was trying to, use the herbs to calm down the vocal dystonia. She had essential tremors and dystonia. She was a mess. But I use acupuncture and herbs and manual therapy, okay, to relax her neck muscles. Because people with cervical dystonia, their neck muscles are tight because they're always, twitching, and so one that I had that's just jumped in my brain is a lawyer. So he has to, stress obviously induces it or makes it worse. So he has to, he doesn't go to court, but he has to talk to his clients and, sometimes negotiate with his, for his clients. And so whenever he gets into stressful situations, his cervical dystonia gets worse. And so we were able to get to the point where he could actually mentally control it, and you could not even see that he has it. I mean, he just look normal, right? Him also, I use herbs and manual therapy. Okay, so those are the situations that I've treated. Let me take a drink of water. All right, let's go. Yeah, so this is the last one that I was going to tell you, the multiple sclerosis. I'm pretty excited about this. Number one, because of the results that we're getting, and number two, because he's a physician, he's an anesthesiologist, and so I'm looking for, to getting him to refer, other patients since he's had such a great success with it. So it's not, I can't say that's going to work for every MS patient, but I would like to share it as a bonus. This will be on Sunday afternoon. Okay. All right, let me go through the questions. That's the last of my slide, and we got about 9 minutes. So I'm going to go through the questions. Do you use scalp acupuncture? I do use scalp acupuncture. Oh, if you have a question, someone just told me there's a Q&A box. That's where I'm reading all the questions, okay? It's actually easier for me to answer them. So I do use scalp acupuncture, but I don't do like Jiao Shun Fa, Zhu, scalp acupuncture. Remember, one system. I don't care where I put the needles. I only have one system. So if you're familiar with balance, with Richard Tan's balance method, that is the basis of my system. Okay. All I did was I made Richard Tan's balance method even more simpler. I mean, he already made it simple enough, steps 1, 2, 3, right? And so for me, my acupuncture technique is called QRA, quick relief acupuncture. There's no points. You don't need to know points. There's no, I need to balance. Like Richard Tan, he has to balance, yin yang. I don't do any of that stuff. There's a global balance. I don't do any of that. Okay. I want things simple. See, the things about my system is it's not just a system. I don't want systems in my clinic. I want duplicatable systems. So what that means is anybody that learns my systems can duplicate it wherever they are, no matter where they are. Okay. No matter what stage of their career they're at. And my associates are probably the best example. Okay. So my associates, when they come and learn, within the first week of going through my systems, actually within the first day that I teach them, they can start producing results. That's how simple my QRA is. There are no points. I hope I can emphasize this enough. There are no magical points. So when you ask me which point treats tremors, I'm going to tell you all of them does. Okay. It has nothing to do with points. It has to do with the image. Okay. So with scalp, I also image the scalp, right? So that's how I use scalp acupuncture. All right, John, if the patient is getting medication at the same time, can you tell if the effect is from your treatment or from the medication? Great question. So majority of my patients, when they come to me, they've already tried the medications and they don't work. And if they did work, they're still, since we're talking about tremors, they're still tremoring like crazy, right? So they still have all those symptoms. That's the reason they walk into our clinic, is because the medications, they may have calmed it down, but it ain't making it any better, right? So what I do, and here's a tidbit, here's a secret that I would highly recommend you do. Videotape all of your patients before you do the treatments, okay? Videotape them. Videotape before and after. There is nothing stronger evidence than you showing your patient, this is the video when we first took, before we started treatments. This is the video now, right? You really don't need to say anything, because another thing about, treating patients is you need to get them to come back. If you only treat them once or twice, you're not going to get the great results. I've treated these patients for over 6 months. I'm not saying it takes that long to get results. I'm saying in order to produce phenomenal results, you need to get them to come back. And there's no better evidence than to say, here's the video before, here's your now. You don't need to say anything more. The evidence is right here, right? And after I show them, then I tell them, okay, so this is what we're going to do for the next month. And what are they going to say? They can see the difference, right? But that's a little on how to close patients. But yeah, so you'll notice the effect with the medications. All right, can we help the step issues with Parkinsonism? I don't know. That's a great question. I don't know. I haven't had enough of Parkinson's that I can say. Okay, so sorry. Patient is not local, so cannot do acupuncture on her. Yeah. For what disorder though? Neil, for what disorder? Stuart, how does CPAP damage the patient? CPAP is just like a medication. It makes the patient's body's organs lazy. So if you're getting forced oxygen, does your respiratory system have to work harder or work less? It's got to work less because you're force feeding oxygen, right? And so instead of, and I'm not saying you do this, if the patient wasn't on a CPAP, then your body has to adapt for the lack of oxygen, right? And the way it's going to adapt is going to improve some functions to compensate for that. And so having that clean slate will allow you to focus on, okay, which organs are not functioning and which are, right? Is the medicinal, Luis, Is medicinal CBD oil by any chance part of your protocols? No, I'm not. I'm not using CBD oil. Okay, I know it's a craze right now. If my patients use it, I let them use it, but it's not part of my treatment plan. I just haven't found success. I did go through, a couple of companies of CBD oil, third-party tested, pharmaceutical grade. And again, remember, since I'm a biochemist, I tested them step by step. I just gave them CBD and see if it worked. I haven't seen great results of neurological conditions just with CBD itself. In conjunction with what I'm doing, it probably work. How about seizures? Nope, I don't do cerebral palsy. I don't treat enough, sorry. Can you explain how CBD is bad for them? I already did that. Have you treated a person with fibromyalgia, which I believe, yeah, fibromyalgia, yes, we are very good at fibromyalgia. Is it a neurological problem? Yeah, it involves the nerves. And using the same protocol, like we have tons of fibro patients. Yes, we can get great results with the same protocol, same treatment system that I'm going to teach on Saturday, Sunday. Patient with essential tremors not local, can't do acupuncture. Essential tremors, you need that you need that stimulation. You need to find someone that can do acupuncture. You need that stimulation, because I'll explain how I'm running out of time, but on Saturday and Sunday, I will explain how acupuncture works. I will explain how I explain to patients how acupuncture works. But you need that physical stimulus to the central nervous system to calm it down. Okay. Tremors arising in the someone's question just went away. How permanent are the results for QRA for insomnia? How long does the treatment last? Great question, Yasmin. I've done both. So with straight just QRA, it can last as long as they maintain their diet and exercise. It will last forever. But I have patients come once a month for maintenance, because shit happens, COVID happens, right? Things that you don't expect happens, and that can just get them off track just a little, and they come back for a tune-up, and then I reset their nervous system, and they're back sleeping great again. So with just my QRA, you can get someone sleeping for years. I've done acupuncture. I've treated insomnia with just herbs. Same thing. The biggest thing with insomnia, the reoccurrence of insomnia, you can say it's stress, right? For women, it's hormonal balance, which is of course caused by stress. So if you have stress affects your adrenal glands, which will affect the hormonal balance. It will affect your liver also. So we know if your liver, your kidney, the Chinese medicine kidney, if they get stressed out, that's going to create hormone fluctuations. And of course, the insomnia will come back. So in those situations, can I really say I fix it permanently? No, because people have to live their daily life. They don't live in a bubble. But can I keep it where they're just coming in once a month and just to maintain it and just fine tune every single time and they're sleeping great? Yes, that's what we do. Okay. Last question. Oh no, it's more. Tremors arising in the torso. Ooh, I haven't had torso tremoring. So I don't know, anonymous attendee. Anonymous attendee, focal dystonia fingers of musicians. I haven't treated a lot of those, so I cannot say, I can't comment too much about that. All right, I answered all the questions right on time. We got 1 more minute. Hopefully I gave you enough information that you will want to learn more about my results on Saturday and Sunday. I'll definitely go in more detail. And I always, so one of my motto that I live by is I always like to overpromise and overdeliver. So that's the reason why I answer everybody's questions. Okay, so that's what I live by. So if I don't overdeliver, please let me know, because I will definitely want to correct that. Okay. Any other questions before Donna comes up? Nope. Think we're good then. You're very welcome, guys.
Okay, thank you, Jimmy, for a great class today. And thank you, everyone, for attending. As promised, today's attendees are invited to watch Saturday's webinar for free, and that is our gift to you. So if you're curious about Jimmy's method and you want to listen in and you're free on Saturday, then here's your chance and for you to come and join the webinar for free. The free access is for the training on that day only. And if you like the class and you want to earn CEUs, or if you want to watch the video replay, then you can upgrade to the paid group. So what you need to do is use this code NeuroWW, that's NEUROWW, and apply it towards Jimmy's Saturday's class. And this code is good for today only. So once it strikes midnight, the offer is over. So you have a lot of time until that happens. So I would recommend doing it now. Again, the code is NeuroWW, and this will give you a free seat to Saturday's webinar. It will be 9 a.m. to 6 p.m. Pacific time. And if you want to upgrade to the CEUs or video replay, you can do that as well. All you have to do is just re-register for the class and just don't enter the coupon code. That's it for today, everyone. Thank you so much. And we will see you this weekend at Jimmy's Full Weekend Webinar. Have a great day.